Hi, my name is Ryan Jarrell. Today I want to ask you a question. Have you ever been riding in your car, your automobile, your truck, and come upon a car accident and see all these emergency medical technicians running around and not knowing what in the world they're doing next? It doesn't make sense to you because you've never done it before. Today, through the eyes of myself as a emergency medical technician, an EMT basic, I want to try to break things down to you, and so it makes a little bit more sense. First, when an EMT first gets onto a scene, you want to make sure you have BSI. BSI is body substance isolation. You want to make sure you have either gloves on, or a gown, or a mask. Something to protect yourself from any viruses or blood or anything you might come in contact with. Next, you want to do a scene size up. You want to be able to look at your environment, what's going on, and you want to see if there's any electrical lines that you might come in contact with, or even just it might go to looking at how many patients you have. You have to know how many patients you have because you might need to call out to more ambulances to get more backup. After you find out how many patients you have, you want to do triage. Triage is ranking your patients from primary to worst likely to survive the crash or the accident, whatever. So the people that are worst off, you want to basically flag them like they probably wouldn't make it to the hospital. The people that are primary, those are the ones that you can pay attention to, get them to the hospital. At that point, once you find out who's the primary, you're going to be working with you and your partner. I have my partner. Let's say we have an accident, and there's one person. Just make it simple. One person in a car accident. I'd have my partner. He would take C-spine on the patient, and all that is just holding the patient's neck and keeping him from moving their neck and further giving him any more injuries to his neck or back. They would put a brace around his neck. At that point, then we're going to do an initial assessment, and that's dealing with the patient's airway. It's called ABCs, airway, breathing, and circulation. With the airway, you can either do a non-rebreather or a nasal cannula. Non-rebreather is a mask that goes over your face, and you can do either 15 liters per minute of oxygen or a nasal cannula, and that's just it's going to be a tube that goes over your ears, and it's going to go right into your nose, and you can do 2 to 6 liters of O2 oxygen. If the patient could be claustrophobic or something, you could use that. Okay, after you do the airway, then you're going to so the airway's all taken care of. Then you're going to do circulation, and that's just taking care of any bleeding. If the patient's turning blue, cyanotic, you can make sure he's on a non-rebreather because you're going to need more O2, up to 15 liters per minute. As soon as we do that, then we're going to be worried about the transportation. We're going to be looking at, do we want to airlift this patient out? Do we want to go by ambulance? In this case, we would go by ambulance, and we would get them en route to the hospital, and my partner would drive. I'd stay in the back, and in the back we would do a head-to-toe assessment of the patient, a rapid assessment, and doing a detailed physical examination, starting from the head, go all the way to the toe, going through every part of the body, going through, it's a process called DCAP BTLS. It's any deformities, it's any contusions, it's abrasions, protrusions, it's burns, tenderness, lacerations, and severity. You want to do those on every part of the body, starting with the head, go through the eyes, the ears, the mouth, and then you want to go to the chest. You want to listen for lung sounds, any broken ribs, you want to note anything like that. Then you want to go to the abdomen. You want to palpate all 4 quadrants. Then you want to go to the pelvic area, and you want to put pressure on their pelvic area to see if there's anything wrong with their pelvic area. Then you want to go to all four extremities, going from your lower extremities, which are your legs, upper extremities, your arms, to see if they have them squeeze your fingers, to see if they have good PMS, that's their pulse motor skills. And if they can squeeze your fingers, that means they have good blood flow going through their arms and their legs. If they can push their toes down against your hands, they're doing good. At that point, then we're going to, we're still en route to the hospital. Then we're going to, we've already done like vital signs en route, and we're going to check their lung sounds, we're going to check their pulse, their blood pressure, and before you get to the hospital, a couple minutes before, you're going to want to reassess and make sure if anything's either gotten worse or maybe even better, that you could comment to the hospital, tell them that they've either improved or gotten worse. At this point, you're at the hospital, and that is my speech.